My name is Senator Sue Morano, and I would like to thank all of you for coming, for taking time out of your busy schedule, and I'd like to welcome you to the Ladies Gallery here at the State House. I'd also like to welcome my dear friend, Senator Teresa Fetter, who's in the back of the room, who's joined us this morning. We are gathered here to talk about an issue that is very near and dear to my heart: access to quality health care. Many of you know I am a practicing registered nurse and am very concerned about women's health. The Coalition for Family Health has been convened by the National Council of Jewish Women and is composed of more than 30 distinguished organizations. The Coalition has called on Ohio lawmakers to pass the Prevention First Act, Senate Bill 179 of the 127th General Assembly, which I had the honor to sponsor, that would require comprehensive sex education in schools, mandate health insurance coverage for contraception, and create a grant program to help fund teenage pregnancy prevention initiatives. I originally introduced Prevention First because it will make sure that women's health needs are no longer viewed as non-essential. Providing women with better access to prescriptive contraceptives, emergency contraceptives, and proper education on how to protect themselves will demonstrate that the needs of women are highly valued. It is my hope that with this backing of this very impressive coalition, that the legislation will become law. Now, I am very pleased to have the opportunity to introduce our guide for this event. We are so fortunate to have Judy Wolf with us today. Coming from the Cleveland area, Judy is an experienced and effective educator and mentor. As Ohio State Public Affairs Chair for the National Council of Jewish Women, or NCJW, Judy is responsible for representing the NCJW on state policy issues, monitoring Ohio legislative and public policy issues, coordinating state legislative initiatives, and establishing lines of regular communications with state legislators, as well as national legislators on behalf of the NCJW. As you may know, volunteers such as Judy have been at the forefront of social change for more than a century, while taking a progressive stance on women's issues, women's rights, child welfare, and reproductive freedom. Here in Ohio, Judy directs NCJW's efforts as the convening organization for the Coalition for Family Health, representing healthcare and business organizations that continually seek to improve the health of women, children, and families. With Judy's leadership, the NCJW's role with the Coalition for Family Health provides a practical way of bringing the mission of Ohio's Prevention First Act to life.
Before I start with the remarks that I have here today, I know Senator Fetter is so busy and she is such a friend to all of us that I would like her to come up here first. And I know there's so many committee meetings going on. Am I right that you need to get back? A few remarks, why don't you start?
Thank you so much for being gracious. And in this room, I can't help but think we've come a long way, baby. And it's just great to have this Ladies Gallery to do such events and really gather our thoughts and really put our forces together. So thank you for being here. The women have always been there fighting for rights for themselves and for others, and today we find ourselves fighting to keep the right to make decisions for our own bodies. And the women were here today, who you see on the walls, and you're going to see possibly on the monitors and read on the placards. You know, they would say the same thing, that we're doing the right thing for reproductive health care coverage and for fighting for common sense comprehensive sex education. And we have all the facts gathered, so now we build the case and we put the pressure just like the women did in the past. I intend on introducing the Prevention First Act as I've done in the past in the Ohio Senate in the next few weeks, maybe even next week, I understand. Women's women's ability to control her reproductive rights is critical to enabling her to fulfill her dreams, and the dreams that she has for her family, and to maintain self-sufficiency. The Prevention First Act empowers women, especially young women, to take control of their reproductive health with essential information and services to prevent unintended pregnancies. And everyone has that goal in the state of Ohio, and that must be drilled down to all of our representatives in both House and Senate. And we have great people here like Dan Stewart, who has been a champion over the years with myself, even in the House, where we tried to have contraceptive equity, and that simple act was a good. So we do have a lot of work to do. In an era when the right to choose is under attack on all fronts, we must speak out on bills such as Prevention First. Don't let anyone tell you what to do. Isn't that what we tell our daughters nowadays? Don't let anyone tell you what to do. You must stand up against the status quo. What will the Prevention First Act do? It will guarantee prescription contraceptive coverage by providers that cover other prescription drugs. Guarantee that a woman will get her prescription filled by a pharmacist. Plain and simple. Help women have access to emergency contraceptives, and educate young women on methods to protect themselves against unwanted pregnancies and STDs. The Prevention First Act is aimed at lowering the number of abortions in Ohio by giving women access to prescription contraceptives, emergency contraceptives, and education on how to protect themselves. I believe we should uphold the values that hold up our living conditions, the human condition. And this is a big part of our conversation as we talk passionately, as passionately as these women in this room have taught us to do. The values mean giving a woman the proper tools that is necessary for them to have the right to choose and a sustainable quality of life. Values are allowing a woman access to health care. These are talking points that we would tell our colleagues. Values are allowing a woman to make decisions over her own body. I keep saying things over and over, and as an educator, I know it takes repeating something 40 times with your children who are 9 years old to get it through. So we must do the same thing. Let's make this dream of passing the Prevention First Act a reality, just like the passionate, tenacious women of our past have accomplished their common sense dream of our right to vote.